Hi everyone at Rocksteady. In this video, I'm going to be interviewing my professor, Dr. Carlene Johnson, who's a practicing occupational therapist. I'll be asking her some questions about personal care so she can offer useful advice on how to make self-care tasks more manageable. So, Dr. Johnson, thank you so much for taking the time to answer these questions.
Thank you, Christy. It's an honor to be here. I am really excited about Rocksteady and the opportunity to support that work that you're doing there.
Great, thank you so much. Can you start off by sharing with the Boxers a little bit about yourself and what you do as an occupational therapist?
Sure. Well, I have been working for over 30 years now with helping adults adapt after they've had strokes or spinal cord injuries or even Parkinson's disease, multiple sclerosis, lots of different things. I work in inpatient rehabilitation right now, but I've worked in a lot of different settings. In all of those, my goal has always been to help people to regain as much independence as possible in their self-care, in their ability to return to work or to school or to be engaged in the community.
That's wonderful. Thank you for sharing. Now, would you mind explaining how you would help someone with Parkinson's use adaptations to improve their activities of daily living?
Sure. What I really like about occupational therapy is that I think we like to pride ourselves in being holistic. And so one of the things that we'll use is what we call the PEO model, which stands for the person, the environment, and the occupation. So when we're looking at a situation, we like to look at it through all those lenses. And so, for example, the person, well, that just basically means you. That's your thoughts. And as we know with Parkinson's disease, a lot of times those thoughts are not as automatic as they used to be. And so that's something that we can address. In addition, we look at the movements that you have, how your body is functioning, and ways that we can improve that. And we also look at things that have to do with you, like the medication that you're taking and how that might be affecting you at different times. As you know, that makes a big difference. We also look at what's important to you and what are your goals, what are your passions, looking at the roles that you have in your family, in your community. Then we go to the environment, and that's basically everything that's outside of you. So the place where you are, that includes the lighting, it includes the noise, the temperature, the landscape, the type of flooring, how crowded it is or open it is. And then we also look at the objects that you use. We might look at the chair that you typically sit in and the height of it. We might look at the type of soap that you use or the utensils you use. And then finally, we look at the occupation itself. And that can be anything as simple as just your goal is to be able to eat soup better, to be able to get out of bed better, to using the computer, ways to play with your grandchildren, ways to go grocery shopping, and ways to just go out to dinner more effectively. So we look at all of those things.
Great. That's one thing I really appreciate about occupational therapy is how it really looks at the whole person and their whole story and how client-centered it really is. Okay, thank you to Dr. Johnson for explaining the PEO model and a little bit more about what occupational therapists do. In the next few videos that we post, I'm going to be asking her about different topics that you guys at Rocksteady have told me you would like some advice on. So she'll be giving some great tips on making activities such as dressing, eating, getting around your home or the bathroom a lot easier. And I hope you guys enjoy it and watch all of them. So we look forward to it. Please let us know if you have any questions or topics that you would like us to cover. Thanks, guys.